Ladies and gentlemen, thank you very much for the invitation. The Hungarian Medical Association of America is very happy to join the US Return alumni. We really think it's an excellent idea. I worked in the United States for 8 years as a physician, and I returned in 2002, and currently I work as an internist in Rozsakert Medical Center, actually where we have 9 other physicians who trained in the United States. And I also run the Hungary chapter of the HMAA. I would like to introduce you our campaign against smoking. It's a very challenging project, campaign against smoking. So we decided that we will try to approach our goal from different venues in order to be successful. The project started in 2008 when we organized an anti-tobacco conference in Budapest. Then this meeting was followed by a delegation to the Ministry of Health. In the same year, the Buffalo Exchange students carried out an indoor air pollution study, which was actually the first in Hungary which was ever done. This May, László Metzler wrote a letter to the Prime Minister and requested to strengthen the indoor public smoking law. And we also organized an annual HMAA student conference in Balatonfüred, and we decided that we will dedicate a chapter how to prevent smoking and how to treat the harmful effects of smoking. We also decided that we will start a lecture series in the high school. There is a shocking data that 30–40% of the students in the high school do smoke, and 30% of them are exposed to secondhand smoking. So this conference in Budapest was, I think, a real success. We had 300 participants from Hungary and from abroad, and I believe this conference had the widest range of specialties ever on the topic of smoking, from public health to oncology. You can see from the list that there is basically no specialty which is not included somehow in the effects of smoking. We had outstanding international experts invited, Dr. Michael Cummings, who is actually the head of anti-tobacco campaign in the United States. We also invited Dr. Fong, who is the leader of the same campaign in Canada. And we really believe that only teamwork can help to change the smoking policies in Hungary. It was followed by our delegation to the Ministry of Health by our board members and our actual president, also with the international experts. And following our visit, the Minister of Health issued a declaration. In this declaration, he expressed that he will support to change the law to protect non-smokers, and they will also initiate lecture series in elementary schools and high schools. The first indoor air monitoring study was done by 2 Buffalo Exchange students. They measured air pollution in 40 different locations, in restaurants and bars. And they measured that the harmful particles in these different places. They also observed that many places where actually smoking was prohibited, people were still smoking. The conclusion is that if smoking were banned indoors, the air pollution level would decrease with 90%. That means that there is an immediate effect on public health, including heart attacks, including lung disease, respiratory problems, including COPD and cancer as well. This shows very clearly, the first column shows the place where smoking was allowed, and it shows a level of the dangerous particles of 155 microgram per cubic meter. And the last bottom shows the places where smoking was prohibited, and that's 5 microgram cubic meter. You can compare. So if smoking is prohibited, the level of dangerous particles are well below the allowed level. The students published these data in international and Hungarian papers as well. Just want to show you few slides which will justify why we picked the topic of smoking. In every cigarette, there is like 40,000 toxic material, and there are like 200 cancer-related agents. You can see from this slide that there is actually no organ system which is not affected by smoking. And it also shows that how mortality increases from smoking. It increases the rate of cancer deaths by almost 40%. It's lung cancer and other cancers as well. Increases the deaths, the mortality from heart disease by 20%, chronic bronchitis, emphysema another 20%, and other causes, including stroke, by 18%. So our mission is to try to assist in the adoption of the WHO anti-tobacco laws in Hungary, to try to decrease the percent of Hungarian doctors who smoke, try to set a positive example in the society, promoting better health initiatives for all Hungarians, and increase the awareness of the effect of tobacco during pregnancy and childhood. I just want to show you that how huge media coverage and interest we had during and after our anti-smoking conference in 2008. This makes us believe that a civil society can really influence the media, and hopefully through the media can influence people's health. And I think you do not necessarily have to be a physician to participate in this project. So I would like to invite everybody who is interested to join our project. Teamwork is always the best. Thank you for your attention.